Good morning. Today we have lecture 7 in Pharmacology Introduction. The term drug nomenclature implies that there are several names that can be used to identify a drug. Drugs have three different names: chemical name, non-proprietary name, and proprietary name. Chemical name. Chemical name is given when a new chemical entity is developed. It is the name given to a drug in accordance with the rules of chemical nomenclature. أول ما دواء يظهر يكون على شكل مادة كيميائية ما معلوم إنه يعني ممكن تكون drug، إنما يجب أن يتم اختبارها على الانيمالز والhuman to prove that it is a drug and can be later licensed for human use. It is useful for chemists and for technical personnel as it provides the precise arrangement of atoms and atomic groups in the molecule. It is not used to identify the drug in a clinical or marketing situation. Chemical name is useless for clinicians, and for pharmacists it's only useful for workers in pharmaceutical industry. يعني الكيميائيين مفيد لهم هذا chemical name, otherwise it is useless and no one uses it. وهو يعتمد على التركيب الكيميائي للمادة. Now we come to the non-proprietary name or generic name. It's a short name given to a drug that is not subject to proprietary rights. Proprietary rights يقصد بها حقوق الملكية. The non-proprietary name should always be concise and meaningful. This is used in discussion and textbooks. هذا يكون يعني اسم يعني مختصر وبسيط ويستعمل في الرفرنسز والكتب والمصادر. أيضا يستعمل من قبل الشركات ويكون بيفد نوع من الإجماع بين الشركات إنه they all use this name وما خاضع الحقوق الملكية. في حين البروبريتري نيم وما يسمى بالتريد نيم. It's a name given to a drug by a pharmaceutical company which sells the drug. فهو معتمد من قبل الشركة الدوائية المصنعة. Thus a single drug is sold under many proprietary names by different companies. شوف إنه الدواء هو نفسه باراسيتول بس كل شركة تسميه شكل أسماء تجارية مختلفة. They are written with the capital initial letter and are often further distinguished by a superscript R in this encircle. في بعض الأحيان تلاحظون على بعض الأدوية مو بس على الأدوية على تقريبا كل الماركات العلامات التجارية إنه تشوفون this is this small R. This means that this is a trademark علامة تجارية. Clinicians usually described a drug by their proprietary names. Proprietary names are more popular than non-proprietary names. Why? It gives the privilege of choosing a certain company because of the high quality of the product produced by this company. يعطينا إمكانية إنه نختار الدواء النوعية الجيدة من شركة معينة مثلا الفولتاني أو هذا يعني it's a common name but when you buy it in the form of Olfen you produced by شركة ميفا يعني it is much effective. We have this example, paracetamol. The chemical name is N,4-hydroxyphenylacetamide. This is a very hard name useless, cannot be used by clinician or by a pharmacist. While the non-proprietary name in the British pharmacopoeia, or the British approved name is paracetamol. الشركات البريطانية تستعمل اسم paracetamol. While in United States the adopted name in US pharmacopoeia is acetaminophen. فالشركات الأمريكية تستعمل هذه التسمية. The proprietary name عندنا هواية أسماء in the market like Calpol, Panadol, Adol, Tylenol and Anadine. All these are paracetamol, but they are produced by different companies to get some advertisements for the company حتى يتميزون بضاعتهم ويحصلون نوع من الدعاية لمنتجهم هم يصنعوه باسم تجاري مختلف. Over-the-counter drugs (OTC) are sold directly to a consumer without prescription from a healthcare professional, as opposed to a prescription drugs, which may be sold only to consumers possessing a valid prescription. ال OTC هو نظام عالمي إنه some drugs they don't need to be sold by a pharmacist according to prescription. يمكن تلقاها بالمولات، في بعض المحلات أيضا تلقاها. مثال عليها الانالجيسكس الباراسيتامول، بعض الأحيان حتى أدوية تلقاها بعض أدوية الحساسية ما يفايدها من in the market, and they don't need any prescription or to be sold by pharmacists. OTC drugs are selected by regulatory agency. طبعا هذا يختلف من بلد لآخر و it depends on the government to decide which drugs are sold under OTC. In many countries, these drugs are often placed on shelves in self-service areas of stores, بالمخازن والمولات. In contrast, prescription drugs are almost always passed over a counter from pharmacies to the customer depending on prescription. في حين prescription drugs they should be sold by pharmacists according to prescription. Now we come to a topic how to calculate drug dose. First, the first method is by calculating drug formulation unit per time unit. This is the most commonly used method in healthy adults, as tablets times three times daily, or a tablet every 8 hours, or 1 tablespoonful 3 times daily. يعني مجرد انه تذكر انه التاب او الكبسول او مثلا tablespoon how many times per day. Number 2, weight per kg per day, as gram or milligram per kg per day in a number of divided doses. Example, 5 milligram per kg per day in 3 divided doses. Or volume per kg per day as mil per kg per day in number of divided doses. Example, 5 mil per kg per day in 3 divided doses. يعني هنا المقصود بها انه تحسب مثلا هو يعني وزنه فرضا 30 كيلو، ف 5 ملغ per kg يعني 5 في 30 يطلع 150 ملغ per day in 3 divided doses، يعني every 8 hours، يعني راح يصير 50 ملغ in each dose، 50 ملغ every 8 hours. وكذلك بالنسبة للفوليوم إذا كان يعني الشراب يعني هو الدواء، ف يعني as a syrup، فأيضا بنفس الطريقة 5 ml per kg per day يعني إذا كان وزنه 30 ف 5 مل يعني 150 مل. and 3 divide doses for each dose will be 50 ml per dose and or 50 ml every 8 hours. This is used when a drug is risky due to narrow therapeutic index or in child or elderly, renal or hepatic impairment. عادة الحساب per kg هو for such يعني situations. إذا كان narrow therapeutic index أو بهاي الحالات إذا كان child or elderly وإلى آخره. Now we come to another method by using a giving set for adults. giving set هو ما يسمى بجهاز الإعطاء. هذه صندة المدرجة بيها valve اللي مرتبطة بالمغذي. In this method there is a small plastic bottle transparent وهذا مدرج وهذا تحصل به عملية تقطير. يتقطر الفلويد من bottle through this plastic tube كما تلاحظون على اليمين. فهذه يقطر مثل ما تشوفون بالمستشفيات تصير عملية تقطير. ف each ml equals 15 drops. هنا شلون الحساب لازم انت يعني تراقب القطرات تحسب بيدك ساعة يعني تحسب كم قطرة في الدقيقة. فإذا كان عندك 15 drops per minute this means you are giving 1 ml per minute because each ml equals 15 drops. If you need to give 500 ml per 6 hours طبعا هاي تشوفون on the left side it ends with a needle and that will be placed in a cannula or inserted directly into the vein. So if you need to give 500 ml per 6 hours, 500 divided by 6 it equals 83.3 ml per hour, and if we divide it by minute 3.3 times divided by 60 it equals 1.3 ml per minute. And thus if I want 1.3 ml per minute times 15 equals 20.8 drops per minute. 20 يعني انت تراقب جهاز الاعطاء وتتحكم بالفالف هذا اللي تشوفوه on the left side اكو فد شيء يعني مستطيل شكل whitish with a bluish circle. تتحكم بالفالف من حيث سرعة الإعطاء أو عدد الدروبس per minute إلى أن توصله إلى 20.8 drops per minute. طبعا أنا هم نمسة تقريبية هاي 0.8 لو تسويها 21 لو تسويها 20. For pediatric patients يعني للأطفال the giving set is different. It is a big bottle as you can see here in this image, and you fill it with the amount that you need to give, and below this big bottle there is a small tube in which you can see the drops are coming, and again you should calculate the number of drops per minute. Each ml here equals 60 drops. هنا القطرات حجمهن أصغر. Each ml equals 60 drops. So if you want to give 50 ml per 6 hours 50 divided by 6 equals 8.3 ml per hour. 8.3 divided by 60 equals 0.13 ml per minute, and 0.13 times 60 equals 8.3 drops per minute. So you control the adjustment on the valve till you get 8.3 drops per minute. The fourth method is according to body surface area أو ما يسمى بال BSA. It is usual then to calculate the dose according to body weight. Adjustment according to body surface area is also used and may be more appropriate as it correlates better with many physiological phenomena like metabolic rate. It is calculated either by formula هاي المعادلة height in cm times weight in kg divided by 3600 and under square root. All of this under square root is equals BSA in meter square. So, or from special charts, as we will see. According to this chart, the calculation of BSA is done especially in cancer chemotherapy and sometimes in pediatric age group, except for neonates who are treated according to milligram per kg. يعني هنا عندك chart فتشوف انه الهايت مقابل السيرفيس اريا مقابل الويت. جيب مسطرة and you try to draw a straight line from the height of the patient and the weight. راح تلاحظ انه راح يمر في خلال a certain point on the surface area scale, and this is surface area scale for surface area for this patient. Now we have this example for fluid calculation according to body surface area. We have a child with 12 kg and 86 cm height. The body surface area for this child was 0.534, and for 1 meter square this drug should be given as 1500 ml per 24 hours. So according to these findings, so he will require 0.534 times 1500, which equals 801 ml per 24 hours. And thank you for your listening.